Osteoarthritis. The word osteoarthritis is formed by two words. Osteo means bone and arthritis means inflammation of the joint. Osteoarthritis is a degenerative disorder of the joint that particularly affect the articular cartilage. Articular cartilage are the smooth surface that covers and protect the bone ends, where they articulate or meet to form the joint. There is progressive deterioration of the articular cartilage and later on formation of osteophyte, that is new bone formation in case of osteoarthritis. Osteoarthritis may be categorized on the basis of certain characteristic of development. It is said primary when the cause of the disease is unknown. This is generally seen in elderly people or in obese patient or overweight patient. Secondary osteoarthritis. Secondary osteoarthritis is that when there is some definite cause behind the disease, such as previous trauma, fracture, dislocation around or near the joint, rheumatoid arthritis, etc. Osteoarthritis is generally seen in weight-bearing joint, that is in the knee, hip or in the feet. Some non-weight-bearing joint such as the thumb, carpometacarpal joint. Pathology. Pathology of the osteoarthritis means the changes that take place during the course of disease. In osteoarthritis, there is loss of ground substance of the articular cartilage. That is, there is increase in the water content and depletion or exhaustion of the proteoglycans. The proteoglycans are the substance which are responsible for the dissipation of stress. So in these cases, there is disturbances of dissipation or diversion of the stresses on the joint. The collagen fibers of the cartilage therefore subjected to excessive stresses and strain that lead to their rupture. The cartilage develops fissures and rupture of the trabeculi in the subchondral bone. The subchondral bone are the bone which are present underneath or below the cartilage in a joint, and that lead to subchondral cyst formation. Subchondral cyst is a fluid-filled cyst which is present below the articular cartilage. So there is subchondral cyst formation. The cysts are not observed in X-ray. To find out these cysts, we have to go for the MRI scanning. This lead to, and after that, after the course of disease, their synovitis occurs and osteophytes formation, that is new bone formation. Clinical features, that is the sign and symptom of the disease. Number one is pain. Pain is the most common complaint. Initially, pain may be felt during or after the movement. Later on, it may become continuous or even felt at rest condition. Number 2. Swelling or effusion. This might be due to soft tissue inflammation or synovitis around the joint. The fluid is accumulated around the joint, which is obvious. Number 3 is stiffness. Gradually, due to pain and inactivity, stiffness is noticeable. In latter stage, due to pain, capsular contracture and ligamentous instability and muscular imbalance, it may lead to deformity. Radiological changes which are seen in osteoarthritis. In radiological changes or in X-ray, there is narrowing of the joint space, osteophytes formation, articular surface cortical irregularity or sclerosis. Next, subchondral cyst formation, genu varum deformity in case of osteoarthritis knee. In osteoarthritis of knee, generally the space of medial tibiofemoral compartment is reduced, which is distinct. The involvement of patellofemoral compartment is also evident. Treatment. In treatment, conservative physiotherapy management. Number 1, for the management of pain. Various electrotherapy modalities such as SWD, hydrotherapy, IFT, ultrasound therapy may be used for the relief of pain. Cryotherapy may be helpful for the reduction of pain and inflammation. Next one is relaxed passive movement. Relaxed passive movement is helpful to maintain the joint range without any stress over the joint when the patient is unable to perform the movement actively. Isometric exercises. The isometric exercises of the quadriceps muscle is helpful. Speedy isometrics and sustained isometrics are helpful in osteoarthritis of the knee joint. Stretching. Stretching of the muscles and soft tissue is important. It is helpful during the course of mobilization. Traction may be used during the course of mobilization. It relieves the stress from the joint. Next one is progressive resisted exercise. It increases the strength and endurance of the muscle of the joint which are affected. It helps to reduce the load from the joint. Next is non-weight bearing resisted exercise are more helpful.